First, let's turn to today's health headlines. We are talking about a new flu variant Yale physicians have their eye on and why this is such a concern.
Yes, joining us to talk about this more is Dr. Scott Roberts, Yale Medicine infectious diseases doctor, assistant professor at Yale School of Medicine, and associate medical director for infection control at Yale New Haven Hospital. Good morning to you, doctor, and thanks for joining us.
Good morning.
Oh, looks like we can't hear you.
Can you hear us, doctor?
I can.
All
you hear me?
right, perfect. We got you.
Sorry about that.
That's okay.
That is totally fine. So, doctor, let's talk about this new variant. It's called Subclade K. For those who haven't heard of it before, break this down for us.
So this is a variant of an existing flu strain called Flu A, subtype H3N2. And everyone knows a COVID variants. This is really the same thing with the flu. So the flu mutated a little bit more than what we were expecting this year. Anytime we see this, we worry it overcomes our existing immune defenses and leads to more people getting infected. And that's what we saw. We had a pretty bad flu season this year due to this Subclade K. Some people are calling it the super flu, but there's really no evidence suggesting it's more severe than prior strains. It's really just everybody got infected all at once at the same time.
Okay, and I have to ask you, and I'm sorry if this may, sound controversial, but is this why so many people this season were saying, or thinking, I should say, that the vaccine maybe wasn't working?
Yeah, so the vaccine is made of 3 flu components. There's 2 for flu A and 1 for flu B. And there was a bit of a mismatch between the one that we had this holiday surge with the existing vaccine that was made, which needs to be made in the summer, months in advance. And so what happened is the flu mutated a little bit more than what the vaccine manufacturers were expecting. And so for that one strain, our immune system was not as robust as we wanted it to be, and it led to all these infections around the holidays.
Yeah. Oh, very interesting. All right, so tell us, doctor, what are you seeing right now in the hospital? Just how many cases of this variant of the flu are you seeing, and who is most at risk right now?
So the good news is we've seen significant declines in flu from where we peaked really around the holiday season. There is still a good amount of flu out there. Who's most at risk? I worry about the extremes of age, especially infants under age 6 months. These at that age are really too young to get vaccinated. And so we really rely on people around them not bringing flu and exposing them. I also worry about individuals with pre-existing conditions that put them at high risk. Some examples there are pre-existing lung disease like asthma or COPD, and then people being immunocompromised for any reason. Immunity is really our best defense against the flu, and when you don't have that, it can lead to severe infection.
Absolutely. So I guess, is it too late to get the flu shot? Not too late? What is your recommendation?
We are getting toward the end of flu season, so we're approaching that late barrier, but it's not too late yet. And the reason is that flu season usually extends into the spring. So oftentimes we see it end in April and even May. And the other reason is the flu vaccine covers 3 flu strains, 2 from flu A, 1 from flu B. And usually flu B is the one that causes a spring wave. And so that's the one we're keeping an eye on right now. Right now it's low, but it's starting to slowly uptick. So hopefully we can ride this out and have a quiet rest of the flu season.
Very interesting. Thank you so much.
Thank you for joining us today, doctor. Really appreciate it. That was Dr. Scott Roberts.